Thank you to all. Today in my audio video classes, yesterday I have talked about the grading of symptom. Now we are continuing evaluation of symptom. After finishing analysis, in evaluation I have already told about the first grading, which symptoms have highest value we keep at first. And thereafter, according to importance, the grade is coming down from 4, 3, 2, 1. Different philosophy have different value of symptom. As for example, as like body actions, we give higher value to the location, sensation, modality, and concomitants. It has to modalities, concomitants, and sensation. Also, location in particular case. Just Kant says about he give high value to generalization, general symptom. In general, he give high value to mental general, then physical general, then particular. Therefore, there are different type of cases, and the two schools we have used in evaluation. Which type of case you have seen? कैसा केस मिलता है? If a case have more particular, have less general, then use modulation method of evaluation. If there is more general, then we use Kant. It does not mean that if you go from two, either from Kant or modulation, medicine will change. Never. Medicine will come same. How to approach? In this concept, I am today dealing about the basic elements or traits of symptom. Symptom का basic element क्या है, trait क्या है, कैसे उसको? I have broadly divided them. First in sensation. I have to give him sensation, and after sensation, along with sign and symptoms, with in area, location, and with concomitant or associated symptom. Concomitant or associated symptoms. And in last, coming modalities. This is the trait, how to start from case taking, just from particular to general. This is the modulation concept for, because when you go, particularly beginners, which symptom give a highest value? From Kant, from modulation, we confuse. So, best way to, by modulation method, how to complete the symptom. So this is why we call the basic element of symptom. These are the basic elements of symptom. I think clear. So on this basis, first start location. Location, the symptom will be given by sensation. How do you feel? How look, and their modalities. Some tensor modalities, time modalities, seasonal modalities, posture modalities, they are different modalities. So we always require first component. As for example, a patient says that I am suffering from severe pain in abdomen. We ask where pain is located, in mid-epigastric region, umbilical region, right hypochondria, left hypochondria. Whatever the position, you may first find where pain is located. Thereafter, how do you feel? Like pinching, stabbing, cutting, twisting, burning. Burning how? Like coal, like acid. So these are the terminology to define the symptom. And this way, then you write down. So sensation completed. After sensation, question like red, yellow, pale, these are the signs. Swelling, lymphatic swelling, general swelling. Along with this, what is concomitant? Concomitant association. Sometimes so many doctors say these are both same thing. Actually, cannot say correctly the concomitant or associated symptom is same thing. As per body medicine, associated symptoms always present, as like headache with vertigo, coughing with involuntary urination, coughing with cramp in the limb. So such symptoms are along with the main symptom in another part of the body. The cough is related with the lungs, but limbs is also their symptom. That is not related with the lungs. But this is appears same time when cough has been started. So this term is called as associated symptom. And what about concomitant? Associated symptoms always with acute condition, acute headache, acute. Suppose that vomiting, better by eating. This is also associated symptom. Modality is similarly diarrhea, cholera-like symptom and every menses. हर मंस के स्पंद में दिस इज प्योर कॉन्कमिटेंट बिकॉज बोथ आर डिफरेंट ऑर्गन symptoms from different organ. As for example, when you think about the disease aggravates. This is direct relation from mind to physical. As for example, a headache relieved after profuse urination. This is a modality, but different. So such type of symptoms are called as associated. While menses during cholera-like during menses, it is pure concomitant. And because there is no physiological or relation, because headache, vertigo, maybe both are in head, but menses in female genital organ and diarrhea is from GIT organ. So they are separate. तो इस तरह के जो सिम्टम आएंगे that is called concomitant and associated with the main symptom. Then due to that vertigo, headache, etc., that along with that are called associated, or we can say concomitant of symptom. So there is quite difference between concomitant symptom and concomitant of symptom. Sometimes they meet, both are look at the X are concomitant have no relation between pathophysiological. They separate but start at that time. But concomitant symptom, main symptom के साथ डायरिया के साथ आपको अगर वॉमिटिंग हो रहा है, डायरिया के साथ आपको वर्टिगो आ रहा है ना, डायरिया के साथ आपको माने पेन इन द लिम्स हो रहा है आपको, इससे सो दिस इज concomitant, very important, high volume, but very rare to find. It is never find always. ये सिम्टम बहुत कम मिलता है ना, और मिलता तो है. Next point, I am going to location. First point to give location. What is location? Why location important? One reason give highest value for location because it is very important in particular disease and where very few general symptoms found or general symptoms not present. In that condition, we give priority. As for example, pain in the लेफ्ट लोब ऑफ लीवर, ये किसका है, किस मेडिसिन का सिम्टम है? फिर पैटर्न ऑफ द कार्डियस मैरिनस, वेरी इंपॉर्टेंट. पेन इन द लोअर एंगल ऑफ स्कैपुला, राइट साइड, किसका सिम्टम? चेलिडोनिया. पेन कफिंग, ड्यूरिंग कफिंग, पेन इन द डिस्टेंट पार्ट, किसका है? कैप्सिकम. तो ये सब चीजें जो हैं हेल्प अस इन टू इवेलुएट और eliminate the location. Next is sensation. Patients say pain like cutting, stitching, pricking, tingling, formication, crawling. It's very important to individualize evaluation of the symptom from sensation. So many medicine have sensation to you. I like the fever-like sensation in the throat. किसका है? Dorsal. Coughing, fever-like. तो ये सिम्टम सेंसेशन भी हमको हेल्प करता है एवेल्युएशन में, हाई वैल्यू में. बट सो मेनी मेडिसिन मेटेमेट का वेरी इंपॉर्टेंट सेंसेशन, peculiar sensation. Next, modality, very important. Modality is one of the best way of individualization. Modalities have different time modalities, circumstantial modalities, environmental modalities, posture modalities. Some have standing is the worst, some have sitting is worse, some have better by lying on backward, some lie on knee elbow position, some like curve, like a sis. So these are the posture of modalities program. Next important, they have concomitant, they have delivered about the concomitant. There are so many medicines for concomitant. For example, cough with pain in head, cough with concomitant, cough with pain in head, cough causes soreness in the fourth part of the chest. Cough with intolerable pain in larynx, hold the throat during coughing. इसमें these are the concomitant associated symptoms among them. So here to decide, pain in the chest, we know cough is a disease of lungs, and lungs, pain in the lungs, pain in the chest. Chest is muscular pain. There may be like brania. In lungs, there will be ranunculus, etc. So they're different. Pain in the organ lungs, pain in the chest. Both are located. So how will differentiate pain in lungs को कैसे differentiate करें और chest में कैसे differentiate? Lungs के साथ जो होगा तो when you सांस लेंगे छोड़ेंगे तो दर्द होगा. That is the symptom of the lungs. पर वही जब movement करेंगे, लेटेंगे तो प्रेशर करेंगे, it is a movement of the muscles. तो muscular pain, जैसे brania, works from slightest movements, but better on lying on painful side. Lungs में when breathing, then stitching pain, ranunculus bulbosus, kalika. These are the, so here you have to differentiate the symptom of what? Symptom of internal organ or symptom of external organ. Both are attached together. Location is the same. So here we try to find out the where pain is located, either external or internal. Next point. Sometimes concomitants are defined according to pathology or फिजियोलॉजी, दोनों से हम लोग कैसे देखें, एनाटॉमिकली, फिजियोलॉजिकली और पैथोलॉजिकली. जैसे if you have suffering from diabetes, thirst will increase. No? This is due to diabetes. This is a common symptom. But what is uncommon? When you are not thirsty. High fever, you are thirsty. This is common. But when high fever, you are not thirsty at all. I like the simium and brymia. So, this type of symptoms, their association should be marked properly for evaluation of symptoms. That's all. Next.